Canada continues to fall short of its vaccine targets for adults, especially those over the age of 65. Infectious diseases physician Dr. Zain Chagla joins us now with more on the top 3 shots that older adults should be talking to their doctors about. Nice to see you again. We haven't seen you in ages.
Good morning. Always a pleasure to be here.
Okay, so what are these top 3 vaccines? Top of my mind, shingles comes up.
Yeah, absolutely. So there are the routine vaccines that are, available for adults over 65, so influenza and COVID-19. But there are 3 vaccines that older adults are eligible for that are quite important to get. So the shingles vaccine, as you mentioned, the vaccine against pneumonia, pneumococcal vaccine, and the new RSV vaccine, which is only available last year, where, those are diseases that disproportionately affect older people. They're limited vaccines in the sense that they're only single or 2 doses. They don't have to be updated annually. But there's a big gap in terms of people that are eligible for these vaccines versus people who actually get these vaccines.
And why is that? Have we just not been, because of COVID, that kind of disrupted everything?
Yeah, absolutely. So access to primary care and access to actual vaccinations. People are, seeing their doctors episodically rather than seeing them for routine prevention. Access to the vaccines. We've done a lot to expand in pharmacies, but that's really something that's come out of COVID. And, unfortunately, some of these vaccines are not publicly funded. And so that does create a limitation for some individuals. Not that they're not important, but when cost comes to it, especially in some of the financial environment we're in, people often don't have the ability to pay for these vaccines.
Right. And what's the end result if you're not vaccinated?
Yeah, I mean, these are vaccines for diseases that are, around in the population. These are not diseases that are rare. People do get shingles, especially every decade of life after they're 50. People are exposed to RSV. We learned about that a couple of years ago, that it's around. And pneumonia is very common. Bacterial pneumonia is very common. So, you're going into an age group where you're susceptible. You're going into an age group where your ability to fight infections is less, and you're going into that age group without the protection that's there to help minimize the disease, which is incredibly important.
And RSV, that's it's a lung disease or a lung virus. What is that again?
So it's a virus that is acquired. People get it a few times during their lifetimes. We worry about it predominantly in kids that are young, but we know in adults, particularly over the age of 65, it can hospitalize just as many people as influenza. When people are hospitalized, there's a 1 in 9 chance of dying of RSV while in hospital, and it circulates during the same time of year as influenza. So, again, this is a virus that hasn't had a vaccine for many years, despite good research towards it. We now have 2 vaccines that are on the market, ready for this season. We've had a single year to vaccinate and a lot of good uptake. But, certainly older adults, particularly those with underlying conditions, really do face a higher risk from this. And it is, again, a disease we can actually keep people out of hospital with the vaccine.
Okay. Do you need a doctor's prescription? Can you go to your pharmacist if you're 65 and older and get these shots?
So, discuss it with your pharmacist. Some of them are available. Some of them do need a doctor's prescription. Additionally, for things like coverage with private insurance, they may need a doctor's prescription associated. But, there's lots of ways to collaborate together to get them done. Again, it's worth it to talk to your pharmacist in terms of what's involved and where to go. It's worth it to talk to your primary care. But I think everyone is on the same page. If people are interested in these vaccines, providers are very willing to give a prescription for it.
Okay. Nice to chat with you again and not talk about COVID. Yeah. We saw an awful lot of you during COVID. Not that we didn't welcome you on the show, but it's nice to see you for something else now.
No problem. All the best. Take care.
Okay, Dr. Zain Chagla, thanks very much.